Good morning, everyone. Today is Wednesday, April the 23rd, 2025. And I'm here this morning in the wee hours of the morning to put out this video about to follow up on the actual video that I posted about GERD. I posted about the signs and symptoms and the pathophysiology of GERD. This time I'm going to post about medications that can help combat GERD or help bring down the signs and symptoms of GERD based on the medication that I currently take. So I take two medications. I take Protonics and I take Pepcid. Let's get into it. What is Pepcid? Pepcid is a histamine 2 blocker that works by decreasing the amount of acid the stomach produces. Okay, so when GERD arises and you have that increase, that influx of stomach acid that seems to come up instead of being digested downward towards the body, Pepcid is used to treat and prevent ulcers in the stomach and in the intestines. Excuse me, my tongue got stuck. And it treats conditions in the stomach that produces too much acid. And one of the conditions is called Zollinger-Ellison syndrome. Pepcid treats GERD and other conditions that acid backs up from the stomach in the esophagus and causes heartburn. Okay, so before taking Pepcid, you have to tell your doctor whether or not you have any kidney or liver diseases, a history of long QT syndrome, stomach cancer, asthma, COPD, and other breathing symptoms, because this can span over different systems in the body. Okay, so first of all, you got to consult with your doctor. Your doctor has to put you on what they think is best for you and is right for you. The symptoms of heartburn can be confused with a heart attack. That's number one. And if your symptoms of heartburn is not relieved, it could possibly be a medical emergency. So don't take this teaching lightly. You know, GERD, we think of it as an everyday thing, but we have to be sensitive to what our body is telling us. So, when to seek medical emergency? When you have chest pain or heavy feeling, pain spreading to the arm and shoulder, nausea, sweating, and generally ill feeling. You should not take Pepcid if you are allergic to Pepcid or similar medicines such as Zantac, Tagamet, or Axid. Okay, before taking this medicine, you should consult the doctor whether or not you have kidney disease, liver disease, stomach cancer, and long QT. And you should ask your doctor about taking Pepcid if you're pregnant or breastfeeding. And you got Pepcid in different forms. You can take this medicine with or without food. It can be liquid form or pill form. And the side effects. Well, backing up from the side effects, you have to avoid alcohol when taking Pepcid because it can risk a damage to your stomach. And you have to avoid other stomach acid reducers unless your doctor has told you it's okay to take them. You may take an antacid, such as Maalox, Mylanta, Gaviscon, Milkamon, Rolaids, or Tums with Pepcid. Pepcid side effects. The things that can start alerting you that you have an adverse reaction to Pepcid are hives, difficult breathing, swelling in your face, lip, tongue, or throat. And you need to stop using Pepcid if you experience confusion, hallucinations, agitation, lack of energy, a seizure, fast or bounding heartbeat, sudden dizziness, unexplained muscle pain, tenderness, or weakness, especially if you have fever, usually tiredness and dark colored urine. Some side effects may be more likely in older people and in people who have serious kidney disease. Common Pepcid side effects include headache, dizziness, constipation, and diarrhea. Now, these are just a couple of things that can help you break down and help you be able to understand this medication more thoroughly. So if you're taking Pepcid, first ask your doctor if it's right for you, and really take heed to a lot of the signs and symptoms of how this drug reacts in your body. And if you have any questions, you report the side effects to the FDA, and the number is 1-800-FDA-1088. And that's all that I got on Pepcid. We're going to start another video on some other medications that are effective against GERD. Thanks. Have a great day.